Hello students, myself Dr. Karthik from the Department of Oral Medicine Radiology, working as additional professor, Vinaya Mission Sankaracharya Dental College, Vinaya Missions Research Foundation, Salem. I'd like to speak on a few points about digital imaging. The contents of today's seminar is digital imaging. What do you mean by digital imaging? Sensors used in digital imaging, such as CMOS sensors, photostimulable phosphoplates, the main advantages of digital imaging, the main disadvantages of digital imaging. Digital imaging is also known as a filmless imaging method of capturing the radiographic images. It is a filmless method of capturing, processing and storing radiographic dental images using specialized electronic sensors and computer monitors. The process involves using a sensor to capture the X-ray images, which are then converted into digital data and are displayed instantly on a computer monitor. The various sensors used in digital imaging include wireless sensors and wired sensors. The wired sensors are chiefly employed in digital dentistry include complementary metal oxide sensors. The wireless sensors commonly used in digital imaging is photostimulable phosphoplates, abbreviated as PSP plates. The PSP plates are shown in the picture, which is thin, which look exactly like IOP film, and they are available in various sizes such as 0, 1, 2, 3, 4. There are two types of digital imaging. One is direct digital imaging technique and the other is indirect digital imaging technique. Direct digital imaging technique uses CMOS sensors which are connected by fiber optic cables. The indirect digital imaging uses photostimulable phosphoplates. They are wireless sensors but requires an additional laser scan machine for reproduction of the radiographic images. The main advantages of digital imaging include reduced radiation exposure, almost 50 to 90% less than that of a radiographic exposure required for a conventional intraoral periapical radiographic films. And they have the main advantage of no chemical processing solutions are required and the images are instantly available on a computer monitor. So easy electronic storage, retrieval and sharing of radiographic images are the main advantages of digital imaging. Apart from that, digital imaging also has enhanced diagnostic capabilities such as the zoom, contrast and measurement tools are available in the computer monitor, and using these parameters the contrast zoom can be magnified and adjusted in a radiographic image. They are environmental friendly, no processing chemicals or wastage of films, better patient communication through showing the radiographic images to the patient. The main disadvantages of digital imaging are their high initial equipment cost, and sometimes the sensor can cause discomfort while placing the sensors inside the oral cavity with anatomical variations such as tori. Some sensors such as PSP plates are fragile and they can lead to break if excessively bent while doing the procedures. And of course there are some compatibility issues with the software can arise after installing the softwares in the computers. They pose infection control challenges. Each time the sensors to be covered with individual disposable plastic sleeves to prevent cross-contamination of the saliva while using them on the patient. The sensors cannot be heat sterilized. That's the main another disadvantage of digital sensors. Coming to the composition of a CMOS sensor. The CMOS sensors are built using standard semiconductor technology. It works on a principles on active pixel sensor architecture, in which a core of pixel contains photodiodes along with CMOS transistor switch. The single processing units consists of transistor, which gain and amplify the signals, and analog to digital converters embedded on integrated silicon chips. There is a micro lens array that is placed over a layer of photodiodes and also a layer of Bayer filter which helps in filtering the green, red, blue wavelength of the incident X-ray photons. The CMOS sensor has the following parts. It has a thick back housing cable and front housing is a cable, and there is a electronic chips embedded in an electronic substrate, and there is a fiber optic plate and there is a scintillator screen. The main advantages of CMOS sensor include their low power consumption compared to CCD sensors, their fast image readout and processing, they are reduced susceptibility to radiation damage, they have increased on-chip functionality and integration, low manufacturing cost, particularly at high production volumes. The composition of charge-coupled device sensors are also based on silicon-based integrated circuits containing pixel array containing dense matrix of photodiodes. These photodiodes are capable of capturing the light, and in addition they contain polysilicon gate electrodes which helps in clocking the signals received by the sensors. Apart from this, there is an on-chip amplifier which amplifies the incoming signals, and the amplifier also has analog digital converters. This is the mechanism of charge coupled device. They are based on generation of electron hole pair, such as in this picture where the valence electron from valence band is transferred to the conduction band on receiving the X-ray from the interval perimeter radiographic machines. The charge injection device sensors are high purity and they are N-type epitaxial silicon layers are the more important composition of charge injection device sensors. Apart from this, they contain two coupled metal oxide semiconductor capacitors. They have the main advantage of intra-cell charge transfer for faster readout. Hence, non-destructive readout is possible in charge injection devices, meaning the charge can be read multiple times without clearing the pixel, allowing for longer integration times, improved signal-to-noise ratios in low-light conditions. Hence, these CAD sensors are most commonly used in inductively coupled plasma optical emission spectroscopy, shortly abbreviated as ICP-OES. Apart from that, their radiation hardness is inherent property of charge injection devices, hence used in spaces. They also have an anti-blooming effect. The excess charge from an overexposed pixel spills over into the adjacent pixels. Comparing the CCD and CMOS sensors, the image quality of CCD is higher whereas lower in CMOS. The power consumption of CCD sensors are higher and lower in CMOS. Slower readout in CCD, faster readout in CMOS, more expensive to manufacture in CCD. Hence, CCD are still costlier than CMOS sensors. CMOS sensors are less expensive and cost effective. Their CCD sensors are less integrated, require more external components. CMOS sensors are highly integrated and amplifiers and analog digital converters corresponding to each pixels. The signal are amplified after charge transfer in CCD. Each pixel has its own amplifier in CMOS. CCD sensors are used in scientific imaging and high-end cameras. CMOS sensors are used in consumer cameras, smartphones. Manufacturing is more complex in CCD sensors, whereas CMOS sensors are simpler, uses standard semiconductor process. The photostimulable phosphor plates contain europium doped with barium fluorohalide. They are available in various sizes. This is the PSP plate machine which scans radiographic image. It's a woodpecker PSP machine available in the department. PSP plates based when light is excited from the X-ray photons, EU2 plus are converted into EU3 plus and they are excited to the conduction band. And again, the F centers, the valence electrons are transmitted to F centers. The main advantages of PSP plates, they are wireless, has a property of erase memory. Single PSP plates can be reused for n number of times, say 50,000 times. There are no need of darkroom or chemical processing. They have a wide dynamic range, reducing the risk of over and under exposure. The main disadvantage of PSP plates include easy fragility and a tendency to break if excessively bent. They require additional infrared laser scan for reproduction of the radiographic image. I conclude my lecture saying digital imaging will still remain a cornerstone of innovation, offering new possibilities of visualizing the radiographic images, communication and data management in radiology. It enables remote consultations and filmless technology. Thank you.